So what is cyanosis? Cyanosis is the bluish discoloration of the skin membrane. It is biochemically caused by increasing the quantity of the reduced hemoglobin, that is, more than 4 gram percentage, which is most commonly seen in the superficial blood capillaries and subpapillary venous plexus. There are two types of cyanosis, peripheral cyanosis and the central cyanosis. Peripheral cyanosis, warming resolves the peripheral cyanosis but not the central cyanosis. This is a quick checkpoint. Then we have some of few exam tabs and the clinical variants of the cyanosis. So we have methemoglobinemia and the sulfohemoglobinemia. When the patient show bluish discoloration, then this is known as cyanosis. What is cyanosis? It is a bluish discoloration, but the patient are not breathless, means there is no dyspnea. Then we have a carbon monoxide poisoning. In case of carbon monoxide poisoning, there is carboxyhemoglobin, which is caused by a distinct cherry red discoloration, which is not a true cyanosis. So, carboxyhemoglobinemia is due to CO poisoning, that is carbon monoxide poisoning. Then there is one exception. In anemic patient may not develop the cyanosis even under severe hypoxic conditions because their absolute reduced hemoglobin levels struggle to reach the threshold of more than 4 gram percentage due to overall low level of the hemoglobin mass. Now, where do you inspect for cyanosis? Most commonly, lips and oral cavity mucosa, where tongue is the best site for central cyanosis, nail beds of the fingers and toes. Apart from that, the malar areas of the cheeks and the earlobes are also the most common site for inspection for cyanosis. Then we have two types of cyanosis, central cyanosis and the peripheral cyanosis. Now, what are the main causes of central cyanosis? Central cyanosis, there is imperfect arterial oxygenation saturation or there is abnormal hemoglobin derivatives. Then, in case of peripheral cyanosis, there is excessive oxygen extraction from the systemic capillaries due to slow peripheral blood flow. So, peripheral cyanosis is due to slow peripheral blood flows, whereas central cyanosis is due to abnormal hemoglobin derivatives. Most common sites for central cyanosis are the mucous membrane, including tongue, oral cavity, and general skin and the nail beds. However, for peripheral cyanosis, the most commonly affected sites are the limbs, fingers, toes, and skin, apart from mucous membrane and tongue. In case of central cyanosis, the temperature of the extremities are the warm, whereas central cyanosis, the warm temperature changes to the cold temperature in the peripheral cyanosis. Now, what is the effect of warming? So, in case of central cyanosis, there is no effect. Warming does not abolish the central cyanosis. However, warming increases the local blood flow and abolish the peripheral cyanosis. So, extremities are warm in central cyanosis. So, if decrease in warming does not abolish central cyanosis, but warming in case of peripheral cyanosis abolish the peripheral cyanosis. Now there is a mixed type of cyanosis. In case of heart failure, cyanosis associated with severe heart failure is typically of the mixed type, which present both the features of central cyanosis, means poor oxygenation of the blood in lungs, and peripheral cyanosis, that is sluggish flow or the low rate of blood flow to low cardiac output. Now, what are the causes of cyanosis? Central cyanosis is mainly seen in the people living in high altitude areas due to decrease in the partial pressure of oxygen, and mainly seen in other respiratory diseases such as COPD, chronic obstructive pulmonary disease, extensive pneumonia, acute pulmonary edema, massive pulmonary embolism, and other cardiac diseases like the congenital heart diseases, cyanotic heart diseases, or the TOF, that is tetralogy of Fallot, or the Eisenmenger syndrome, and the severe heart failure, which you all have studied in the cardiac diseases. Then we have abnormal hemoglobin abnormal hemoglobin like methemoglobin and sulfohemoglobinemia, which we already discussed previously. Then the causes of peripheral cyanosis are the cold exposure, where there is a local vasoconstriction of the blood vessels which slow down the capillary perfusion. Then we have the heart failure, where there is reduced cardiac output, which trigger the compensatory peripheral shunting and the vasoconstrictions. Then we have the arterial obstruction, where there is embolism or localized spasm, which restrict the inflow of the blood. Then we have the venous obstruction, in which there is sluggish egress of the blood, leading to localized stasis and deoxygenation, which leads to peripheral cyanosis.